So when I think about Carol, I think of a number of adjectives: compassionate, committed, and also the idea of service.
Let me just be upfront here. I'm not an unbiased observer here. We've been married for over 30 years. She is what I would call a consummate nurturer. She rarely, if ever, enters a negotiation without expecting whoever she's negotiating with to gain equally with her.
She's devoted her whole career to public health, particularly in the area of infectious diseases, having major local and global impact on diseases like HIV and tuberculosis.
She did this at a time when certainly there were women in medicine, but there weren't nearly as many as there are today, and the pathway was certainly more challenging. Her toughness and resiliency really were one of the characteristics that led to her success.
Her approach to medicine and to problem solving is really an approach that gets all the information, all the data, applies her knowledge, and really focuses on details to move things forward.
For many years, Carol was the head of the Advocacy and External Relations group in this Tuberculosis Trials Consortium. She was well ahead of her time in the idea that people who are affected by problems, in this case tuberculosis, should be involved in the solutions. And so she helped to draw external entities and patients who'd been affected by TB into the work so they could say, this is what matters to us, this is what research questions we think are important.
It gives me enormous pleasure to congratulate you, Carol, on receipt of this award. There's absolutely no question that you deserve it.
Carol, I extend my warmest congratulations. You are so qualified for this very special award.
This is one of many capstones to a long, productive, and distinguished career that you've had, and it's richly deserved.
I'm Dr. Carol Hamilton. I'm an emeritus professor at Duke University, and I am this year's University of Utah School of Medicine winner of the Distinguished Alumni Award. I worked in HIV/AIDS and tuberculosis, both diseases being ones that many people fled from in a way. When I first started doing work with HIV/AIDS, there was still a lot of stigma and fear around that. So I wanted to be part of figuring out the cure, the remedy, etc. And so I went into it in a big way, both in laboratory research and clinical research. I would like to thank several people who have nominated me for this award, starting with my husband, Dr. John Hamilton. I appreciate my daughter, who started first grade when I started medical school, so I was not a traditional student. I want to take this opportunity to thank the University of Utah and the Alumni Organization for giving me this award. I also want to thank the leadership of the University of Utah back in the late 70s and early 80s, who took the chance to take more of us women into that school year so that we could show our worth. I hope that I have made you proud. Thank you.